we will start with asking dear Bhagwan Sri Sathya Sai Baba for his guidance and his blessings as we start, and hopefully that he will give us energy and strength to restart the reopening of our centers. So please join with me to say 3 ohms, and we will start the presentation. Om. 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 So Sai Ram, Brother Shiva, Brother Sister Preeti, and Sai Ram brothers and sisters. Brother Shiva had contacted us a little while ago and requested that we do an update just as things are changing across the country. And obviously things are reopening. We're hopefully moving to a better stage of the pandemic. And so Brother Avi has kindly put together an update presentation for all of us. And also we did send a Google poll for any questions, but haven't received any questions. So we'll field any questions at the end. And after Brother Avi's presentation, I'm sure there'll be any discussions or any things that we may have to discuss. So without further ado, Brother Shiva, is there anything that you wanted to particularly to say?
Not specifically. I think I probably, before Brother Avi starts, maybe just give me a minute. I just wanted to thank everyone for joining us today. And all of you have been doing an amazing job of keeping your Sai centers afloat through many different sort of ways of using Zooms, and it's been a challenging period for all of us. Personally, I'm sure all of you, as well as keeping your Sai centers still continuing to function. And so I just wanted to show my gratitude and our gratitude for all that you're doing for your congregations. And I hope that with Sister Nishi and Brother Avi and Sister Patricia's advice, we can slowly begin to, really looking forward to getting back into the center. I so much miss Bhajans live, but I'm sure that that there's a lot of questions, and I think that's what they're here for. The other thing I wanted to add is that that I know that a lot of things are going on, especially with the conflict on invasion in Ukraine, and so prayers is something that that we have to continue to. So it's a little bit of a side topic, but I just wanted to sort of reach out, and I'm sure a lot of centers are having bhajans and daily prayer sessions, and so we have to continue to do so, to pray for all that is going on in the world today. So thank you so much. So Brother Avi, please go ahead.
Thank you. Let me just switch the speaker view here. Okay, Sai Ram, everyone. Thank you for joining us this evening. We wanted to keep today's session as informal as possible, so I'll be going through a few slides, but as Sister Nishi and Brother Shiva already alluded to, we'll try to focus on a lot of the questions, and there has been interest in the past for center presidents and leadership to meet on a Zoom call during the reopening process, just to share ideas and opinions, so we can have some time for that as well. So let me begin. We're over 2 years into the pandemic now. Wow, it's been already so long that we've been in this situation, and I feel that COVID burnout is becoming very common. Parts of the general population are becoming fatigued by the repeated restrictions and lockdowns, and we've seen certainly new waves and new variants of concern, and those may be there may be future waves to come as well, but things in the current state are improving. But we must always keep an eye on the healthcare system, and the restrictions when they are in place are important to keep our healthcare system functioning. When ICUs are filled with COVID cases, there aren't spaces for elective surgeries, even things like cancer surgeries, hip replacements, cataracts, all things that are important to the well-being of our population get delayed because the hospitals get filled with COVID patients. We've seen less people seeking primary care, and assessment for issues which can become worse over time. So what comes next? As I mentioned, currently, as you all know, the situation is improving in Canada. Hospitalization rates are dropping, ICU rates are dropping in most places. We must keep in mind that COVID is unlikely to disappear anytime soon. As I said, new waves are likely to arrive, and immunity will play a key role in avoiding the healthcare system from being overwhelmed. And immunity can be attained through vaccines and boosters, and also natural immunity from infection itself. Now, how can we safely reopen centers? As you know, many provinces are now permitting in-person gatherings in places of worship, including some provinces that have no capacity restrictions under certain circumstances. If permitted by your city laws, centers can certainly be reopened with appropriate safety measures. And ultimately, the decision to attend can rest with the individual members based on their level of comfort and risk profile. The general membership of our center should be aware that risks will continue to exist, risks of infection, severe illness, and spreading to family, friends, and even outbreaks. And the decision to attend should be individualized. High-risk individuals, be it by age or medical illness, vaccination status, the unvaccinated in particular, are more likely to become seriously unwell than other lower-risk individuals. However, the bottom line at the end of the day, attending center is an important part of all of our lives. And missing out on center activities has an impact on our spiritual well-being. So this risk has to be balanced. I'll point you guys to a website here, COVID Visit Risk, that you can go through a questionnaire and input how many people will be at the gathering, will they all be vaccinated, certain answers to questions, and it can actually, and what medical comorbidities the individual has, and it can give you an idea of whether the gathering that you're attending is high risk, low risk, moderate, and that can help guide people somewhat. These are some key factors, general strategies for a safe reopening. Strategies will vary from city to city, but in general, encouraging vaccination, physical distancing and capacity limits, proper use of masks, hand hygiene, respiratory etiquette, screening attendees, so and volunteers, so active versus self-screening. Self-screening meaning the attendees, go through a questionnaire themselves and look out for symptoms before attending. Active screening for volunteers would mean, center staff actually asking questions, and cleaning and disinfecting, and of course, appropriate ventilation and duration of events. Developing a reopening plan to safely return to activities. So our medical committee no longer maintains guidelines for centers. In the beginning of the pandemic, we were putting together specific guidelines with strategies and tips, but we found that every province was doing things a little different. So, and the recommendations varied from city to city. So we actually stopped producing our own guidelines, but we're encouraging people to refer to their city-specific guidelines. Most cities and provinces have guidelines for places of worship, which must be followed and are very frequently updated. I reviewed the Toronto guidelines, for example, on the weekend, and I noticed now they're not even on the website anymore as of today. They said that they're in the process of releasing new guidelines that reflect the recent changes that we've seen in Toronto. Also, it's important that center executive not only review the latest public health guidelines, but also the legal documents that these guidelines are based upon, as these are more important and more definitive than the ones on your city website. So in the bottom there, I have some screenshots of what the public health guideline looks like on the right, but then the actual orders for Ontario on the left, which can be found online as well. The medical committee is here to help you identify the appropriate documents if you can't find them, and answer any questions and support you through the process of reopening. This is just our reopening cycle. The updated one, which I updated recently, will be posted on our website, which you can find at the bottom right there, scimedical.ca. It's just similar to the one we had in last July. But basically, the process of reopening starts at the top there with center executives reviewing public health guidelines, but also regularly monitoring for updates and to ensure ongoing compliance. As I said, it can be challenging to find the appropriate documents. So if you need support, please let us know. And then using these guidelines, the center executive can develop or modify the reopening plan and review that plan with your center executive. Can I just remind everyone to please have yourself on mute, and Nishi, if you can mute all participants. In some cities, it's actually required to have an official safety plan. So for example, I'll go based on, because I'm in Toronto. In Toronto, they are advising all centers or businesses, as they say, to have an official safety plan on hand. So it is important for every center to make one, especially if it's mandatory in your city. The next step after developing your plan and reviewing it with the executive would be to inform the medical committee of your intent to reopen. We have a Google form, which just has some very basic and general.
We can't hear you, you're muted.
Yeah, sorry, I think I just got muted when everyone got muted.
Sorry.
No problem. Yeah, so I was saying it's important to submit this Google form after you've made your plan, because the SSSIO Canada executive would like to be aware of which centers are opening when. And approval from our medical committee is not required. We're just here to support you. If you would like us to review your plan, absolutely, we're here to help you through the process. And then, after reopening the center, the next step is to adapt and respond to challenges, because there certainly will be, as I said, there may be new waves, there may be further restrictions coming. You may face, situations with outbreaks and so on. And, we're here to support you through that. I will also mention, because I know there are members from the education wing here, if your center has SSSE programming, developing a reopening plan also includes reviewing the school and childcare center guidelines, which most cities will have as well. And we can direct you to those if you cannot find them. A common question that has come up in the past is about singing. So we all know that singing at Budgeons is very important and essential part of our center functioning. Singing is thought to be a higher risk activity for COVID spread, but the degree to which singing contributes to the risk of transmission is unclear in the medical literature. There are strategies which can potentially mitigate the risks, but again, the evidence is limited. The decision to resume singing is one that every center should make independently after consulting with their executives and general membership. For example, lower risk individuals And lower risk, I mean individuals who are vaccinated and generally healthy may wish to participate in person in singing, whereas individuals at higher risk for severe outcomes should carefully weigh the risks and benefits of attending singing programs. And if participating, they should pay particular attention to the preventative measures. How can we reduce the risks that come with singing? So there are a few documents which we've identified which can help your center to implement strategies. So Manitoba and Alberta have come out with detailed advice on strategies which can be used. And we recommend that every center review these documents along with their local public health guidelines and literature specific to your city. You'll see the documents in my references, but we can also send these documents to anyone that's interested in reviewing. In general, there have been some medical reviews looking at mitigation strategies for singing and instrument playing. And the general advice is, standard public health measures such as screening, social distancing, sanitizing of surfaces, respiratory etiquette, so like covering your cough and so on, hand hygiene, and mask use, including singers, along with interventions that are specific to the actual environment or setting, such as, increased ventilation, shorter events, and appropriate positioning of the singers can actually, could be used to mitigate the risks of singing. But again, the medical evidence is a bit lacking. There are other strategies also outlined in the previously mentioned Manitoba and Alberta documents. And lastly, centers can always reach out to your public health unit to inquire what other strategies are being used by places of worship in your city. Program duration and course. So this is an important one as well. So, scientists looked at the aerosols expelled by singing, and they concluded that the lowest risk for spreading COVID was at a time of less than 30 minutes if indoors and less than 60 minutes if outdoors. But the evidence in that is not very high quality. They weren't very robust or large studies. There's also a common question that comes up about chorus and bhajan. Having attendees partake in chorus singing potentially increases the number of sources of a potential outbreak. You can imagine if a few members of the audience are infected, having everyone singing just creates so many more sources for spread. So it's recommended for centers to assign rotating lead singers and chorus singers, and at this time, not permitting the audience to participate in singing. There are also questions that we've received in the past about mandating vaccination for attendees. So, we encourage, extending invitation to all, but centers may elect to have their own policy on vaccination status. It's a challenging decision, we know, for center executives as your members, may have opposing views. We've heard that some may feel safer knowing that everyone is vaccinated, but then some may also feel overly restricted by such rules. You may wish to anonymously poll your membership to establish the vaccination rates before making a decision. And it should be a decision made by the executive while incorporating the views of the general membership. And this may vary from center to center. In terms of gurus for SSSE and mandatory vaccination. So we know that, especially classes with younger children or large classes in confined areas, students, they do pose a higher risk. Younger students as well may not be able to follow the risk reducing strategies like proper masking and hand hygiene and so on. And all children are not vaccinated, due to age or other factors. Some provinces are, require teachers and staff at educational facilities to be fully vaccinated. And if they're not, they may be required to perform frequent testing, for example. If your province has the requirement, centers should apply this to their SSSE gurus. Please review your province's COVID-19 guidelines for elementary and secondary schools and childcare centers for guidance on this question. These guidelines also have other specific advice, which for education and childcare programming that SSSE programs should follow. So not only for this question about mandatory vaccination or not, but also other advice that should be implemented. We recommend all individuals involved in planning and organizing SSSE should review these important documents. You may find some contradictory recommendations between, the guidelines for childcare centers versus elementary school and secondary schools. But we recommend applying the more stringent of the rules because we know that SSSE covers a broad range of ages, and the younger groups of SSSE may actually be considered childcare. I'll hand it over to Nishi just to wrap up our slide deck today with some take-home messages.
Sairam, Avi, thank you for such an excellent presentation and covering all the key points and updates that we need. I think we are just going to come with some take-home messages that we want to leave you with before we open up it to discussion. So remembering now we've shifted into a pandemic, which has now become endemic, that COVID is here to stay. It's not going to disappear. So we have to now embrace and adapt. And so we have to, with the centers, we know that we'll still have to have restrictions. There are still restrictions across Canada right now for indoor, for masking, I believe. And so we have to adapt our centers and our rules and what we're going to do, the etiquettes in our centers when we do reopen, being ever prepared to adapt to the changing dynamics. So before we were having the thing, oh, when is the pandemic going to be over? But now, because the virus is going to be here to stay and we'll get increasing immunity in the community, it's going to be safer. So higher public immunity, vaccinations, and with people getting infections. And we now hear that with the Omicron, people are getting sick, but they're milder illnesses, but they're getting developing immunity. But it means that we can reopen, we can start reducing restrictions with the goal to return to normal activities as much as possible. And we may also have to incorporate a new normal. So that will be an evolving landscape of what we will all have to adjust with. For the reopening, as Avi mentioned, we have to always check our provincial guidelines. They do change. And sometimes, as some provincial guidelines would post something on singing, then that they don't post it anymore. So things are changing, and it's really important to look at that. As you said, assess your own membership and plan in advance. So make sure that the executive is in touch with what the membership is feeling. Some people, have come to us and said, we should be opening. And then the flip side, some people are saying, oh, I don't think you should open yet. And so now that landscape has shifted. We are moving into a safer reopening, but we do have to still take in consideration the population and how much vulnerability or how much risk our individual members have. And then really giving the permission to centers that when they reopen, to really communicate to the membership, say, if you're not worried, if you're not safe, if you're worried or you don't feel safe to attend yet, take your time. We're still going to do some online stuff, provide an online participation for those who are not comfortable quite yet, because after being 2 years in a pandemic and being locked down, to suddenly return, some people don't feel so comfortable, others will. And again, following all the precautions to minimize risk. Masks are still important, hand washing is still important, and making sure that we don't return to just sort of congregating without any social distancing, and without that new normal is going to be a new normal. It's not going to be exactly where we were 2 years ago pre-pandemic. Very important around singing, and it's going to be a controversial issue in the centers, I'm sure. And every center is going to have to really look at what they are able to do. Singing does carry a higher risk. It's not a huge high risk. We don't know that, though. We don't know the exact quantity. We do know that outbreaks have been there. So please follow the guidelines to minimize the the risk associated with budget singing or with singing if you are going to introduce singing into the center. That's so key because, you know, obviously we want to keep everybody safe. Vaccination status, again, you know, certainly we want to welcome everybody if possible. We know that the guidelines do say that attendance of an unvaccinated person with precautions, with masks and other precautions, it's a low risk. So we do really want to have centers open to everybody. But again, as Avi said, you know, we have the ability, the government has given that go ahead for places of worship to elect to choose vaccination status or not. So that is something that each individual center will have to work on. As Avi said, follow the guidelines for the SSC gurus. That's also going to be a little bit of a controversy or a difficult situation because in Ontario and BC, the mandates are very different for teachers. I believe in Ontario there is a vaccine mandate, and in BC there is not, but I haven't looked at the most recent update on that. And then just, you know, really at the end of the day, we have to understand risk, right? We know that the risk of infection is going to be present, whether you're going to the shopping mall, whether you're going to a restaurant, whether you're going to work or you're, you know, in a classroom. So there is going to be risk for everybody. And we have to weigh that against the importance of our centers and the spiritual haven that the Sai Center presents. So our role as Sai Centers the role that we have to take is to minimize the risk, but still be open to provide a place for spiritual growth and spiritual haven for our membership. And so if we are doing that, we're trying to find the middle ground and the balance, and certainly understanding that vulnerable populations, you know, maybe we want to have a delayed entry for some of the people who are not quite comfortable or at high risk. And those are the things that having a dialogue and having a plan and communicating that plan to your centers and saying, maybe we'll start with this group or maybe we'll open it all depending on your membership comfort zone. So again, we are here to help you. Please reach out to us if there's any questions. And I think at this point, like I said, we haven't received any questions on the Google form, but maybe we can, Abby, we can look at raising hands or have an open discussion on what we think it would be, what are the discussion issues or points that we would have. And Brother Shiva, maybe I'll just open it with you if there's any questions you have.
Yeah.